By the way, questions in the audience here? Raise your hand real quick. I'll go back if not, but I don't want to keep this all on my own. So, go ahead. Ken Davis, yeah, Mount Sinai Hospital.
As you look at what's happened to the ACA as it plays out, what do you wish we could have done differently?
The Affordable Care Act, for those who didn't hear the beginning.
Well, you know, I think Ken leads a great hospital in New York, Mount Sinai, so he sees it all firsthand. Look, I have three basic points that I would make quickly. One, there wasn't anything else that could pass. I mean, this was, as you often see in legislation, if we want to try to insure more Americans and create an insurance system that will be incentivized to insure middle-income, working people, there are not many ways to do it. And if we're going to extend Medicaid so that more working poor people get access, it was cobbled together. Everybody who worked on it would tell you it was cobbled together. There were a lot of aspects of it, however, that were really popular and remain so. You know, ending discrimination against pre-existing conditions, putting young people on their parents' policies for a number more years so that they can be insured while they're trying to find a decent job with insurance, and looking at more transparency and more data collection that can then be used for health purposes. A lot of good aspects, but like any complicated piece of legislation, it's going to need careful analysis and revision. So I think the question should be thrown into the future. You know, given where we are now, given the fact that at least the latest analyses I've been seeing are quite positive. People feel that they're getting insurance that they can rely on at affordable prices in most cases. Now remember, about little less than half the states aren't doing it, so we don't have that data. And the Medicaid numbers are really proving that people are finally getting health care that maybe they never had before, they postponed. So the story is becoming a more positive story, but there are still problems, and there are still elements of it that have to be implemented. So I think we need, if we can do such a thing, we need an evidence-based analysis, and then try to figure out what needs to be done to try to satisfy legitimate concerns. But you know, I think that the argument over repealing it is over. I mean, there are some hardcore folks still making it, but I think that argument is over.
Given what you just said, what are a couple of things that you would hope a functional government might be able to fix in the future?
Well, I think denying Medicaid on totally political grounds is really unfair. So you have a... you know, when the Supreme Court upheld the Affordable Care Act, Justice Roberts, writing for the majority, said, we're upholding it. It is within the constitutional authority of the Congress. However, mandating Medicaid coverage is not, so it has to be left to the states. And many states have jumped at the chance to actually fund hospitals like Mount Sinai, a research hospital, by getting a steadier revenue stream. Some very notable states, Texas being the largest, have said no. We're not going to provide insurance through the exchange, and we're not going to expand Medicaid. So we're going to have a real-life experiment going on. And I think it's going to be quite interesting. So when you say, what can you change? I want to see the evidence. If as we believe, we're going to see better health outcomes and gradually more cost-effective pricing of insurance and better control over big costs within the Medicaid system because of getting Medicaid patients into the healthcare system, then we're going to be able to better judge what needs to be fixed and what doesn't. Now, some things have been postponed, like the small business requirement, and that's going to be difficult because, you know, we're going to have to see how much the market can bear. But a lot of the states have done a much better job than anybody predicted, and they're unusual states. I mean, two of my favorite examples are Kentucky, where the governor of Kentucky took this on and implemented a Kentucky healthcare plan that includes both insurance and Medicaid for some of the poorest people in America, and it seems to be really working well. Now, it's the same problem I found when I worked on healthcare. You know, people would say in big settings like this, keep the government out of my healthcare. And I'd say, have you ever heard of Medicare? And for a lot of people, that just didn't add up. They didn't think of Medicare as being a government program. And so there was a lot of disconnect in understanding what we were trying to accomplish. And then in Arkansas, by a huge bipartisan majority, the state put the Medicaid program out to private insurers and are having a competition over it. So we're learning what's working, and we're seeing, you know, a big state like California see what they come with in terms of costs compared to a big state like Texas or a big state like New York. So we're going to have a lot more information in a year or two than we do right now. But I think we should be mending it, not ending it, going forward.
Thank you.